All right.
All right.
Welcome back, OSLP family.
Welcome.
This is RC Life Podcast. And this is Mel.
And this is Kelly. And today we have somebody, not something, somebody pretty cool. We have not had a bariatric therapist on, and we were lucky to be able to connect with her.
Yes.
And I'm excited because we got a lot of questions on our Instagram of people wanting to know all these sorts of things.
Yeah.
And so we're going to get down to the nitty gritty and find out how to battle these mental things that happen after surgery.
Yeah, because I feel like that could be almost harder to overcome than the physical one.
I feel like 100%. And some people, I think before surgery don't agree with that. But then once they go through the surgery, they're like, oh yeah, mental's the hardest.
Yeah, 100%. Yeah.
So
I had that stereotype. I was like, oh, I'll be fine. So you will see that it was not fine.
Yes, exactly. So without further ado, welcome Dr. Shapiro onto the podcast.
Thank you. Thank you for having me.
Thank you for being on. We have been searching for a therapist for a very long time.
Yes,
so we are excited to ask you all the questions and find out how to battle this mental minefield.
Yeah. There's a lot. I'm sure we can talk for hours and hours and hours about it.
Right.
Yeah, tell our listeners a little about yourself.
So my name is Jennifer Shapiro. I'm a psychologist, clinical psychologist in San Diego, California, at Everybody Behavioral Health, which is a private practice, but we have several therapists and dietitians, and we only work with eating disorders. So everything from anorexia nervosa, bulimia nervosa, binge eating, and then we do a lot with bariatric surgery. So, that's the pre-op psych evaluations that most people are required to have. And then we'll work with some people pre-operatively and some people post-operatively as well, and groups for, the emotional eating side of things.
Yeah, that's where I'm at. So we'll cover that in a little bit.
Yeah.
And where did you go to school?
I went to school at University at Albany in New York. So SUNY Albany, people may have heard of it that way. And then, so I did my undergraduate there, and then I did my master's and PhD there. And then on your last year of clinical psychology, it's required that you do an internship. And so the way that works is you apply to, various programs around the country, and then there's, you rank what place you want to go to. And then there's something called match day, and then you're matched, and that's where you find out where you're going to do your internship.
Oh, very cool.
Yeah. So I did my internship at Duke, which is in North Carolina. And that was 1 year. And then I ended up staying in North Carolina for another 6 years. And I worked at UNC Chapel Hill in the eating disorders program, the Department of Psychiatry.
Wow.
And then I moved to California in 2009.
Wow. That's a lot of moving.
Moly.
You literally made your way across the country.
Yeah, you
right?
did.
Yeah.
Yep. East Coast, South, West Coast.
Yeah.
I love it. I love it.
Yeah.
Yep.
So do you specialize in eating disorders first and then became in the bariatric world, or how did that work?
Yeah, no, that's a good question. So when I started graduate school, I was really focused on eating disorders and obesity. So right when I started, that's pretty much all that I did.
Okay.
But I didn't get into bariatric surgery until I was at internship at Duke. So one of my rotations was in the bariatric surgery department. And that's when I really learned about it and became really interested in seeing what is the role of a psychologist in bariatric surgery and how much behavior change is really required.
Okay.
Yeah, definitely.
What is the main difference between regular therapy, I guess not bariatric therapy, but
just not bariatric therapy and then bariatric therapy?
Yeah.
Okay.
Yeah.
How you would specialize. How do you specialize in bariatric surgery? Is that a better question?
Yeah, I think so. Yeah.
Okay. I think that's a good question, actually, because at first I wasn't sure what you were asking, but for example, people can just go to any clinical psychologist, right? So why would they want to go to bariatrics, someone that knows bariatric, right?
Yeah. There we go.
I think there's a lot of reasons. So, first of all, in terms of the evaluation in and of itself,
Mhm.
if you go to a general psychologist, they may not have any idea of what a bariatric surgeon is even interested in, right? For the
Ah,
evaluation,
okay.
right? So the evaluation might focus on your childhood, or it might focus on, your, do you hear voices? Do you, like really going through the whole diagnostic, categories of everything out there. Whereas none of that is really necessary for a bariatric evaluation. But what's really important is your eating behaviors. And if there's an eating disorder, if there's binge eating, if there's purging, some of the risks that are involved, what the procedure entails. And general psychologists could be the best psychologist in the world, but if they don't know this specific area, it's not going to really benefit anybody.
Oh, look at that, people.
Yeah.
That's why it's so important.
That's why it's important to see a
Sure.
bariatric therapist.
Yeah.
I didn't even, because I think mine was just a generic therapist, psychologist. And I'm kind of wishing that it had been an actual bariatric therapist, because I think I would have been able to deal with my eating a little bit better.
Yeah. Yeah. The food addiction part, the binging at night and stuff.
The binging, definitely.
Yeah.
So,
Yes.
I mean, what, if you don't mind me asking,
You ask all the questions.
Yeah.
Yeah. I mean, so it could have been a great therapist that you went to.
Yeah, she was awesome.
Yeah.
But
did she know these things though? Did she know about bariatric surgery? Did she know what it entailed?
No, because she was doing her internship.
Okay.
And so that's who I got placed with when I started my program. And she actually ended up leaving right at the end of, like, right after I had surgery. And so I didn't have a contact person after. And the person that they had brought in, he was not very good. And he basically told me to go see somebody else.
Oh no.
I was like having serious issues. And he's like, so here's a list. You'll have to call these people.
Right.
Okay.
Alrighty then.
Well,
Yeah.
I was like, I feel like this is where I should be, because this is my bariatric
Team.
Yeah.
Yeah. So that was, I mean, she was amazing, but I also think that there were different points that could have been addressed
Probably.
maybe a little bit better.
Yeah.
The fact that I had an eating disorder when I was in my teen years, and I did not realize that I binged at night.
Oh, until now.
Yeah.
Yeah.
So, and that could have been something that I could have dealt with prior to surgery.
Yeah.
Had I known to share that, because I was just like, oh, it's, number one, my eating disorder, that was back in my teens. So why do I need to talk about it now? And then the binge eating, I didn't even realize until your whole world goes up in flames. And then you're like, how do I deal with stress?
Right.
Oh, I eat at night. That's what I do. So,
right.
Then you have a tiny tummy.
Yeah.
You can't do what you want to do, and you get very frustrated, and you get I got upset and cried. I get that.
Yeah. And someone that doesn't know the specifics about bariatric surgery, they may not know what to ask.
Yeah.
And
what things you might be struggling.
And I think that's where it was, is that I didn't have that guidance almost to say okay, well, we don't need to talk about your childhood, but let's have you had an eating disorder? What do you do at night when you stress? All of those things that I know now that are good questions to ask yourself. I didn't know then, because I didn't know what I was getting myself into.
Right. Yeah.
So, yeah.
Well, and you know what else? People are spending so much time and so much money and so much effort on their surgery. And if they go see someone that doesn't know how to do a clearance, you run the risk of also not getting cleared for not a good reason.
Yeah, exactly. And this could be because I know for me, it helped my mental health a lot getting the surgery, because then I was able to move. I was able to do these things that I wasn't able to do before. But I would it's I don't know. It's kind of a fine line for me. I wish that I had done more, but then it kind of helped my mental. I don't know. I don't know if that makes sense. In my head, it makes sense.
Yeah. Yeah. You want to know what the issues are. You want to know what the triggers are and what you're struggling with beforehand.
Exactly.
Yeah.
Exactly. And I learned definitely that I can't keep the food in the house. Like I won't physically go get it but if I'm at the store and I buy it and bring it home with me, then I can binge on it because I was already at the store. But if I'm at home and I'm like, I really want candy, I won't drive to the store and go get candy. So if I don't keep it in the house, I don't binge eat.
Yeah. 100%. I mean, I've said this 1,000 times.
Then I'll
just
binge
like,
eat almonds.
Yeah, it's just that you
And
don't
that's fine.
you'll binge eat almonds.
Yeah.
But yeah, like I've said it 1,000 times that you don't put a crack in a crack house. So you're not gonna put like food addiction people in a house full of the food that they want to eat all
Exactly.
the time.
Yeah.
Like that's just not.
Yeah.
Not
I
smart by
would
any
eat all of
means.
it.
Yeah.
Yeah.
I feel you. Same thing.
So can we kind of expand more on like binge eating?
Yeah.
Like what it is? What are some signs that you have binge eating?
Should we go through all of the eating disorders?
I mean, we
Is
can,
that
if you want.
Sure.
Okay.
Yeah.
Maybe
Okay.
just a light overview.
Just a light
of-
overview.
Yeah, of what they
Yeah.
are.
I'll just, I'll talk about the main ones.
Okay.
Okay.
Yeah.
So anorexia nervosa, and that's
Mhm.
when someone is underweight, so significantly underweight, or has a fear of weight gain.
Okay.
And they restrict their eating.
Mhm.
There are some people that have anorexia nervosa, that also binge and purge.
Okay.
Not as common,
Mhm.
but the main feature of that one is underweight.
Okay.
And so sometimes we actually see that in after bariatric surgery, a
Mhm.
person loses too much weight and then has fear of weight regain.
Mhm.
Not
I would-
common, but sometimes.
Yeah. Yeah. I definitely kind of was hitting that towards
Mhm.
the last year.
You're real tiny.
I was tiny and I was not eating enough.
Yeah.
And I was very scared to even gain a pound. I was
Yeah.
Yeah, she wouldn't eat
very
potatoes
scared.
at all. I was like, it's okay to have a
Nope.
spoonful of potatoes.
I ate meat and a couple bites of vegetables and cheese.
Yeah.
That was my diet. So,
And some of that is probably normal, right? If
Okay.
you have this history of being, in the obese range, and then
Mhm.
you lose all of this weight, and now you're at a healthy weight, I would imagine there is some fear that you're going to end up right back where you started, especially if you've tried various diets in the past and they didn't work.
Yeah.
Yep, which I have.
I think
I've
we've
tried
all,
everything.
yeah,
Yeah.
all of us are like, we've done everything we could.
Yes,
Yeah.
exactly. So then bulimia.
So bulimia, people with bulimia are not typically underweight.
Okay.
They can be average weight, within a normal range. They can be overweight. But the main features of that is binge eating, which we'll
Mhm.
talk about in a minute,
Okay.
and then compensatory behaviors. So making yourself throw up,
Okay.
restriction, intense exercise, excessive exercise,
Okay.
laxatives, any other unhealthy way of kind of getting rid of the food that you ate during a binge.
Okay.
Yeah.
So like if you eat like say 5 donuts and then you're like, I'm going to go work out for an hour and a half straight just to burn off those 5 donuts, that would be considered.
Yeah, I mean, that would definitely be considered binge eating, and it would have to be a pattern. If it's a pattern,
Yeah.
Yeah.
So
It's like
like
it's
if
like
it
a red flag.
yeah.
It's a red flag first.
So that would be
Right.
something that you would kind of like think about like, okay, is this happening on a daily basis? Is this happening on a,
Weekly,
common?
exactly,
Yeah. Okay. All right.
exactly.
That makes
Right.
sense.
We don't want to take one instance, because then somebody, if I'm asking questions like that about binge eating, some
Mhm.
people might say, well, yeah, I mean, on Thanksgiving, I, ate so much and I went for a third plate, and that's probably normal, unfortunately, over
Yeah.
Thanksgiving, right? So
Yeah,
let's not
exactly.
include that day.
Yes. Yeah. So no holidays are included in this.
Yeah. Yeah.
I know when I battled bulimia in, I think it was like, what was it, like freshman, sophomore, junior year, I would like do it in secret. So I would like when everybody was gone out of the house, it's random, but it happened a lot. Like, cause I have 3 sisters and a mom. So like there was always somebody in the house, but I would go in and eat as much as I could. And then I would go and throw it all up
Yep.
just to make myself, cause I felt like a roly-poly, when I ate all of that. And I was really not that much overweight.
Nope, you weren't at all.
But I felt like I was.
Yeah.
So yeah, I went to several therapists for it. Nothing helped.
You need an eating disorder.
I did.
Yeah.
I
Yeah.
needed a Dr. Shapiro.
Yeah.
I didn't have one.
Oh, I mean, that's the thing, right? It's if you don't know how to treat it, it's very specific
Yeah.
and has a lot of medical risks too. So that's why it's super important.
What are some of the medical risks?
I mean, depending on which, there are different, for anorexia or bulimia, but I mean, electrolyte imbalances can happen. So your potassium can get out of whack.
Okay.
Certain electrolytes, if they're out of whack, I mean, you could die.
Oh.
Right. Yeah.
Yeah. Okay.
Wow.
Okay.
That is a very serious consequence for that behavior. Okay.
Right. So bulimia, if people are throwing up, they can have acid reflux.
Mm-hmm.
And years of acid reflux isn't good for your health too. It can lead to cancer. Teeth erosion.
Yeah.
Lots of medical and then the psychological risks as well. Depression, anxiety, isolation, which, like what you were talking about, the vast majority of people that are binge eating and or purging are not doing it in front of other people.
Yeah, because it's embarrassing.
You're
making that choice to be, and it's unhealthy when you're doing it.
Right.
Like I knew the risks of what I was doing, but I still didn't care because I felt like it made me, I don't know.
Be in control.
In control. I think that was exactly what it is. Do you find that a lot with anorexia and bulimia? Like it's more of a control?
I don't want to say more of, but it certainly, has to do often with what's going on.
Okay. All right. Yeah. That, I mean, it makes sense.
Yeah.
So.
Yeah. And then binge
eating.
I'm like really excited to hear what you have to say about binge eating.
Yeah, we could talk about the definition of binge eating disorder for so long because we can just break it down by part.
Okay.
So the definition of binge eating.
Okay.
Eating an objectively large amount of food in a short period of time. So let's just kind of stop right there with that part of it. What's objectively large? Who decides that?
Your stomach?
Good call.
Or yourself? I mean, because you can only fit so much. So I'm like,
I mean, my brain instantly goes to like, is it more than normal than what I would?
But who defines that?
Yeah, which is typically myself, I think.
Right?
Yeah, I mean, there's no rule book that says if someone's binge eating on donuts, they have to eat this many for it to be considered a binge. There's no rule book like that.
We make the rules.
Okay.
We make the rules on that.
So yeah, because I would say anything, because like we eat probably 3 or 4 ounces at a time.
Right.
So anything larger than that, I kind of say like, because for me, it's all sweets. I know when I'm binge eating because I am going after something sweet. And so if it is sweet and I'm eating more than 3 or 4 ounces, I know that I'm binging.
Yep. And that's the interesting part of it with people after bariatric surgery. So the first part is eating a large amount of food in a short period of time. So we define that as within a 2-hour period of time. Right?
Okay.
So if you eat 6 donuts over 24 hours, it probably wouldn't be called a binge.
Okay.
But if you do it within 2 hours, it's probably called a binge.
Okay.
And then the second part of the definition is and feeling like you're out of control. So like you can't stop. And here's now the difference between someone who has surgery and someone who didn't have surgery. So, if we're sticking with the donut example, someone who never had bariatric surgery, would we think 6 donuts is a binge? Yeah, if they were pretty decent sized donuts, that could be a binge. But someone who had bariatric surgery, it might be a binge after 2 donuts because if someone can't even normally fit a half of a donut or get sick with a half of a donut and now they're having 2, well, that might be a large amount of food compared to what other bariatric patients would eat in a short period of time and feel like they're out of control. Whereas another person eating 2 donuts is not going to be defined as a binge.
Okay.
Makes sense.
So there's different
levels.
Levels and different comparison versus normies, which is what we call people that have not had surgery.
Yep.
And bariatric patients.
Yeah, because that makes sense. Because like, I used to eat like a whole candy bar. And then like in the beginning of the first couple of years first year I didn't have any. The second year I brought it back into the rotation, which I shouldn't have done. But I started with half and then it built to like a whole one. And then now it's like a king size one. And it's like, it's ridiculous.
It just grows.
It's gross.
Like,
Yeah.
the more you do it, the more it needs, like you always need more
Yeah.
when you have those moments.
Yeah. Yep.
And it's not like, oh, I'm going to have a treat. It's like, you have to have that is how I feel.
Mine's not have to have. I get like this urge to want it. I get like the urge and the like the whole I have to have it. But then I'm thinking like, well, I just want to have it while I do this. And like I start justifying it in my head of like, well, this is normal. Like you can have it now. And I start thinking of all the food I've had and I'm like, no, it's okay. And like, but then I realize, oh, I'm doing this because one, I'm editing. That's kind of like I built a habit that I shouldn't have had. And two, I'm alone. I'm alone. There's no one in here with me. And then sometimes it's like it's because I haven't had any attention from my husband, I'll eat. I've noticed that about myself. Be completely honest with them, like, oh, we haven't like had sexy time in a while. Melly's gonna eat. Like, that's the whole thing. Like, or we haven't like communicated in like a couple days. Melly's gonna eat. So, oh, you're playing video games and we're not talking. We're eating. Like,
yeah,
I get it.
Yeah,
Like,
because he's
you
not
can
there.
recognize. Yeah, you can recognize these are your triggers. It's related to certain emotions that you're having.
Yeah, because I didn't know that before surgery. And I found out after surgery because it would hurt or I couldn't do it. And so I'm like, I actually had to analyze every time I was crying. Why are you crying? Oh, I can't have the things that I want. And I can't have both of the things that I want. I'm not getting the attention I want. And I can't have the food I want. So now I'm breaking down. But now I'm fully aware of what's happening. So I feel like, okay, don't put myself in these situations. Now I have to talk a lot more. Like our communication went through the roof with the bariatric surgery after. Cause like, he's like, what is going on with you? And I'm like, oh, I have, like, you're not up in here. You have no idea. So I have to tell you now. And that's the one prideful I would say, like, is if I communicate, guys, because it's helped a shit ton.
And I can tell you very clearly, if you do not communicate, it is not a good thing.
No.
Divorce party of one over here.
Yeah.
So that's what happens when you don't communicate.
And I think I overly communicate now. I'm just like,
I don't think there's such a thing as overly communicating. I think that like, unless you're not like, if you're being mean, like obviously that's like overly communicating. But I think if you're just like, want to tell your person everything and you want them to tell you everything, I don't think there's anything wrong with that.
I don't think so. I'll just be like a goofball and I'll be like, I had cactus poop today. So
You're so weird.
I know. I'm very random.
Oh my God.
But now I'm so comfortable that I can say those things to him. Before I'd be like, I'm not going to joke around and say these things.
Oh.
I'd be nervous too. Now I'm like fully open. Like I because he knows so much about me now that I'm like, he's just going to laugh at that. Like I can just say these things.
But you're allowing yourself to be your authentic, vulnerable self. And you didn't do that beforehand.
No.
And you would binge instead.
Yeah. 100%.
Yep.
Wow. That was eye-opening for me.
Yeah, ditto.
Yeah. So we were describing binge eating and we got distracted, which happens a lot. So just be prepared for that.
That's okay.
So what is the last part of
the last part? Okay. So it's meeting 3 of the 5 extra criteria. So eating rapidly, eating when not physically hungry, eating until you're uncomfortably full, eating alone because you're embarrassed, and then feeling depressed, disgusted, or guilty afterwards. And now I feel like a nerd walking dictionary that I was able to recite a whole definition like that.
No,
but
we love it.
Very impressed.
That means you're passionate about what you do. And that's
what we like.
Yeah. I love watching the passion and like people, like exactly what you did. Like you were like in it, you knew it by heart. And like that, it makes me know that we have the right person on.
Yeah, it makes
Oh,
me feel more comfortable. Yeah.
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 And I hit all 5 of those. So that
I hit all 5 of them.
Yep.
oh shit.
Yep. Yes, because I'm recognizing a few things as we sit here, because the hard thing for me is I live alone now. I've never lived alone in my life, and I'm now living alone and coping with that and a divorce.
Yeah.
I am definitely doing all 5 of those things.
Yep.
So I definitely eat when I'm not bored, but like I'm stressing about everything. And so a good way of dealing with that for me is eating. And that's not necessarily bad foods. Like I will continue eating cheese or nuts or anything just to fill that emptiness,
Yeah.
I think,
Yeah.
because I'm feeling very empty, and that's where it goes.
I think that's actually a great kind of question or comment that I hear a lot and that I talk with my patients a lot, is the difference between emotional eating and binge eating. Because binge eating can certainly occur, and most often do occur, for emotional reasons, whatever the big emotion is, right? It could even be happy and excited, or it could be sad or stressed, or whatever it is. But people can also emotionally eat, and it doesn't have to be a binge.
Okay.
Similar to, let's look at the alcohol abuse literature. We can, some people can say, I had a stressful day at work, I'd love to go out for a drink with a friend.
Yeah.
That is not binge drinking.
Mm-mm.
Right? Just like, I had a breakup and I want to call my friend and go out for some ice cream tonight. That's different than going to the supermarket and bringing home a half gallon and eating it quickly alone and feeling disgusted afterwards.
Yes.
Yeah.
I will agree with that. Yeah. Just the more you talk, like things are flashing into my, like they're all going off right now.
Yeah. And emotional eating isn't a diagnosis. Lots of people do that. If it becomes a regular habit and it's the only way that you're coping, it's probably not the healthiest thing in the world, right? We would want to find other ways of coping, but it's not a diagnosis, whereas binge eating disorder is a diagnosis.
Okay.
Gotcha.
Okay. So if somebody is like, I think I have a binge eating disorder, like where would they start with like trying to heal, or like where would they go to figure it out?
Yeah. So, definitely working with a therapist experienced in eating disorders would be a great place to start.
Okay.
Sometimes people binge eat purely because of physical hunger. So there are people that will say, I was so busy at work that I didn't make time to eat. Or, oh, I did so good on my diet today, I didn't eat all day. And then your hunger catches up to you, right? So it's not that they had this planned intention to binge, but it's, I was cooking dinner and I was just so starving, I couldn't wait, that I ate this and this and this. So one of the first steps is really making sure that you're eating regular, consistent meals during the day, and you're taking care of your physical hunger, meaning you're not letting yourself get to the point where you can't control yourself anymore.
Okay.
So eating regular meals is usually the first step, and making sure you're having, again, this is, in general for people, I'm not talking only for bariatric surgery, making sure that you're having your food groups, making sure that you're fed.
Yeah.
And then, I would start working with people on, maybe writing down what was happening before you had a binge, so that we can look at patterns. What big emotions are you feeling? What are certain triggers that have been coming up? Because it might be the same thing often, every day that's causing it.
Okay.
I like that.
So stepping back to the journal section, because I hear that a lot. Like through this stressful time in my life, everybody says, write down your feelings.
Yep.
I don't know what to write.
Yeah.
And so like, I'll sit there and I'll stare at the paper, but I feel like an idiot because I don't know what to write down.
Yeah.
Well, don't feel like an idiot, but like,
well, I feel like most people know what they're feeling and I have no idea. Like, so how do you, like, if you're feeling like that, how would you what would you recommend for like a patient that's feeling like that? How would they start doing journaling?
Yeah, that's a good question. And I agree. Don't feel like an idiot. And not everybody understands what they're feeling either.
That's
Okay.
true. Okay.
If you truly don't know what you're feeling or you're not sure what your emotions are, probably the first thing I would do with someone is help them understand what they're feeling. Maybe they don't know the difference between sadness and stress. There are people that truly don't know what feelings feel like. So I would really want to assess that and make sure, like, okay, well, what is sadness for you? Or, thinking about times in their life that they felt sad and what that felt like. Same thing with stress and anxiety. So we really want to capture what that actually feels like. In terms of logging, if you don't know what to log, you can kind of look at it as having some columns on a piece of paper.
Oh.
Okay. So you can have, the date and time, let's just say. You can have a column for food. And what I tell people is if you're not logging because you want to be managing your weight, and you're not interested in calories or grams of protein or anything like that, I don't think you have to be so specific in that column. But if you're managing your binge, if you're logging your binges, you may want to put just the word binge in there, just so that okay, I had a binge here. You don't have to get the specifics down.
Okay.
And then you can separate columns into triggers, thoughts, and feelings. Okay. So one way to separate thoughts and feelings is, I like to look at it as a feeling is a one-word emotion.
Happy, sad.
Thought, exactly.
Okay.
Whereas a thought is a running sentence.
Perfect.
That makes a lot of sense.
Yeah.
Like a lot of sense.
So if someone is, let's say, binge eating because they got into an argument with their husband, you might put binge in the binge column. In the trigger column, it might be argument with my husband.
Okay.
Right now we're thinking, okay, what's going to go in thoughts and feelings? So for some people, they're more likely to be able to figure out what their feeling is, so they can write down, frustrated or scared.
Okay.
Other people may not know the feeling, but they can write down what they were thinking. He doesn't respect me.
Okay. Yeah. Huh. Because I can fill out columns. Like,
there you go.
I'm really good at filling out columns. Like paperwork, I can do paperwork.
You're great with paperwork. Get shit done.
Writing out sentences, not so much my cup of tea.
That's okay.
But I can fill out a chart.
It could be bullets. You don't even have to do sentences.
Yeah, you can make like a little outline.
Yeah, I can do an outline.
Yeah.
We do outlines.
See? Yeah, you can definitely make the journaling work for you.
Yes.
Yeah.
That it breaks it down to where it's not like an overwhelming, like I don't feel overwhelmed thinking of it in that way. Like, okay, did I binge? Yes. Okay. What did I binge? What was happening? And I can pinpoint exactly most of the time what's happening.
It seems like it's making your brain kind of organize, like what's going on.
The thoughts and feelings.
Yeah.
Yeah.
It's like separating them so you can actually know which one is. So that very backward, but
no, I understood what you're saying.
Yeah.
So it more like that's helping the healing process, right? Because you're acknowledging that you're doing these things instead of being like disgusted with yourself in private and then like just kind of brushing it under the rug. Like,
yeah. I mean, the first step is to understand what's happening, right? Even if you don't have any skills, even if you're not doing anything, you're at least kind of collecting data. You're understanding what's happening. Now, sometimes that could be helpful in and of itself, because if you start writing things down before you binge, it's like pressing a pause button.
Ooh.
Yeah, that makes a whole lot of sense to do that.
Okay.
So if because I tend to either binge right before I go to bed, or I will wake up in the middle of the night and I'm eating. And I literally have had fallen asleep while eating. Like that's how much like
Yeah.
I felt like I needed that at that given moment. And I'm just thinking, if I wake up and I just write down what I'm feeling,
That can go a long way.
it could pause it long enough that I'm like, okay, I need to go back to sleep. Like it doesn't make sense to go and get food because I've already had an action of like waking up.
Totally.
Well,
Okay.
Are you processing it, I would say.
Processing.
Because like the time that it takes to process is probably making your brain not want that food anymore.
Yeah.
Am I right?
Yeah. But
Okay.
one thing that I heard you say is if I would just stop, that's the hardest part.
Yeah.
Right. Pressing the pause button, because I don't know if you can relate to this, but usually when people want to binge, they don't want anything to stop them. They don't want to use skills. They want to binge.
100%.
Mhm.
I will agree with that.
Mhm.
Yep.
Right. So you have to press the pause button, even though you don't want to.
You have to force yourself
Mm-hmm.
to go down the uncomfortable path.
Mm-hmm.
Yeah,
And
like
one of the,
sorry.
sorry. No, one of the things I like to tell people is even though you don't want to, you can still have a craving for a binge and still press the pause button and still allow yourself to binge afterwards if you want to.
Okay.
Because then you're not letting the feelings, I don't know. Like, I feel like if you do all the things you're supposed to be like that you do, you're pressing the pause button, you're logging, you're acknowledging the feelings, and you're still, it's more of like a decision instead of like this like crazy,
Like
I've got to go.
overpowering.
Like I've got to go eat and I don't care like anything that gets in my way. I'm going to go eat.
Mm-hmm.
But instead you're making an active choice of like, I'm still going to go eat.
Like a conscious decision.
Yeah.
You made that checklist.
Mm-hmm.
I'm still doing it.
Yeah, absolutely. And then in there are a ton of tools that you can use to help you slow down and then make the decision. So, that takes time and that takes a lot of, really being in the right headspace to say, I know that I really, really want to, but I really want to because my emotions really, really want to. And I need to get my head in check and my emotions in check and then decide, make a decision with my head.
Yes. 100%. I can literally see myself putting that into place.
I think that would be really helpful. Really, really helpful for
And
you, for all of our followers to kind of like figure out what works for them. Because like a column's going to work for you, but like for me could be just writing it down. Or like I like to type, so it might be like typing it out, whatever.
I mean,
whichever, as long as you're doing it.
Yeah,
I think is like the key thing I'm hearing is like stopping, recognizing, and do the action at least. So yeah.
And the 3 meals a day, or the meals, that's me in a nutshell.
Yeah, I've been telling you to eat all day. So,
but I'm not hungry, so I'm like, so. But I know that when I get home, I'm by myself.
Are you prepping for later? Like subconsciously?
Yeah.
Or consciously?
Yeah.
Like you're wanting that binge later tonight?
Not necessarily a binge, but I'm definitely not going to eat on plan. Because like I have leftovers in my fridge from the weekend. So I'm like, oh, it's fine. I'll just have that, because that's my other thing is I'm cooking for one. What's the point? Like,
you're the point, damn it.
I know. I just keep asking I do it every day. I have chicken marinating in the fridge that I can put in a crock pot before I leave, but I don't do that. Instead, I'm like, I won't eat all day and then I'll just have my leftovers. But it's fine because I didn't eat all day.
And these are the things you're telling yourself, right? This is your self-talk. You're basically allowing yourself to do this rather than set limits and say, you have to eat a meal.
Instead of taking ownership of myself, like I did right after surgery, I took complete ownership. I didn't have binges. I was very on point. And then life happens. And I'm choosing to give the binging and the disorder brain like access to do whatever it wants.
It's
I'm
winning.
giving it power
Yeah.
instead of giving my choice, instead of me making the choices.
So if you recognize this about yourself, like what is the easiest way to get in touch with someone so they can get help?
I'm not sure I understand your question. What is the first thing someone should do? Is that
Yeah, like so like say like Kelly, I can see like Kelly would benefit from a bariatric therapist. Like
Okay.
is there like a website, or there's something that makes it easy for like state Pacific maybe to find someone local? Because I feel like I know we've had kind of a tough time to find people, so I don't know if there's a better way.
Well, I think so. We keep saying bariatric therapist,
Mhm.
and I don't think there's an official title out there for bariatric therapist.
Okay.
So you want to look for someone who has worked with the population. Another approach would be an eating disorders therapist. Because
Okay.
an eating disorders therapist certainly should know, these cognitive behavioral skills, or DBT is another treatment approach, which is dialectical behavior therapy. These are tools that are very helpful with binge eating. Now,
Okay.
the reason why a bariatric therapist, if you can kind of, I say it in quotes if people can't see me, but bariatric therapist, meaning someone that works with the bariatric population, because sometimes an eating disorder therapist who works a lot with the anorexia and bulimia populations may not quite understand or know how to approach something from a weight loss bariatric surgery perspective, because they don't work with that a lot. So it's important to have someone who understands bariatric surgery and who understands eating disorders. So there are not a whole lot of people out there. So some of the places that you can probably look are the ASMBS website.
Oh yes.
Okay.
Might have a list of people if they belong to the organization.
Okay.
And then there are certain websites for eating disorder therapists. So there's the Academy for Eating Disorders. There is IADEP, so the International Association of Eating Disorder Professionals, IAEDP.
Okay. Okay.
And then there's a website, ED Referral, Eating Disorder Referral. So those are the places I would generally go if someone, from another state, wants a recommendation. I would look at those websites. But, also now with COVID and telehealth, the many states are getting a little bit relaxed with providers being able to deliver services across state lines. So there may be a chance that if someone lives in a certain state and they don't have access to a provider locally for them, depending on the state that they're in, they may be able to find someone in another state that can help them and do some telehealth.
Okay.
Oh, that'd be nice.
Yeah.
So because like me being in Oregon and then say, you're in California, being able to like virtually talk across the state lines would be nice. I mean, because then you could talk to somebody that actually has the credentials instead of just settling for whatever's close to you.
Right.
Absolutely. So as
Okay.
an example, if that were the real situation right now, as a psychologist in California, and I'm not licensed in Oregon, I would have to look at the Board of Psychology in Oregon and see, what the temporary status is. Can providers from other states deliver services to people who live in Oregon?
Okay. Huh. Good points to have.
Helpful.
Yeah. So there was a question.
We do have some questions from the followers.
A
lot of it is around body dysmorphia.
Yeah.
Mm.
Can you kind of define what the body dysmorphia is? And then we'll go from there, actually.
Yeah.
In your experience with it. Yeah.
Right. And so we have to think about this, like, is it a body dysmorphia thing? So the definition of body dysmorphia, I'm going to read this a little bit because I don't have this one as memorized as my binge eating, but so
we'll give you a pass on that. You have to read it.
So a preoccupation with one or more perceived defects or flaws in physical appearance that are not observable to others.
Okay.
So let's think about that.
Mhm.
So someone has bariatric surgery. Is it a perceived flaw? Like, what are we talking about with body? Like, what I hear from some of my patients would be hanging skin. So I don't know if that's something that you're talking about specifically that you're hearing from your guests, or, that's where I go. So is this a perceived defect, or is this something that actually did happen? And it's more of like a body image thing that we have to work on, if that makes sense.
Oh,
I like it. I noticed a
I
lot
didn't
of
even think
our,
about that side of it,
the body
or like
image.
image issue instead of like body dysmorphia.
Yeah. Because we hear a lot from our followers, it's more or less like not being able to recognize themselves in the mirror.
Yeah.
Is that part of it?
I don't think that I would diagnose someone with body dysmorphia because of that. I think that it makes sense. Someone just underwent a major surgery and like lost a lot of weight very, very quickly. I mean, it kind of sounds a little bit normal that you don't recognize yourself in the mirror as opposed to having a psychological disorder.
Right.
Definitely.
Yeah.
Right?
Yeah.
So I would want to, not diagnose them with that, but instead work on, ways of managing that.
What are some tips?
Well, sometimes when people don't notice their weight loss, a good thing that they can do is one thing is look at a before and after picture, like have two pictures side by side, because they can see it in pictures. They can't see it in the mirror, but they can usually see it in pictures.
Yeah.
Okay.
Okay. Yeah. So
or trying on clothes.
Like absolutely.
Old clothes. Okay.
Yep.
That usually
but
snaps
also,
my brain.
What about thinking about all of the things that you can do differently? Like walking faster, crossing your legs, fitting in a booth at a restaurant. These are things that I hear from my patients. Being able to tie your shoes, being able to go to the bathroom easier, shower easier, sitting in a car and being able to sit closer to the steering wheel.
Yeah.
Those are all non-scale victories for us.
Absolutely.
Yeah, because mine just happened on my brother's graduation, because like we went to the stadium and they had like the tiny chairs, and like they're not really tiny. It's just when I was so big, I would like, the sides would always come over and you'd feel really uncomfortable and you're like on top of someone. Like me and my brother sat down, I was like, oh, I'm in my own seat. Like I can't, like I'm not touching anybody. I was like, oh yeah, like that's a part of it. Like you really are smaller, and you've been smaller. Like you're not 308 pounds anymore, and you're like,
right.
And we've gone 6 years, so I think I'm permanent here now.
Like I battled the not seeing it, but I think because I did side by sides all the time for the podcast and for my Instagram, and I would see it in that. And the way I battle it now is that I have gained some weight since my lowest. And so my brain automatically goes back to, oh, I'm 265 pounds, 600. I was down at 600 pounds. 265 pounds again. Or I look disgusting in everything I try on, because I know what I looked like at 140 pounds, but I'm at 165.
Yeah.
So it really, and I try to focus on the non-scale victories and all, side by sides, because I'm still not 265.
No,
but I tend to like go more negative on the self-talk.
I think that's a big part of it, is being able to catch yourself and then also forgive yourself. Slips happen. And it's actually pretty common that people kind of get to their lowest and bump back up a little bit, right? So being able to forgive yourself for that and recognizing all of your successes, and then kind of being able to press the pause button a little bit and figure out, okay, well, is this just a natural kind of dip down and dip back up? Or am I aware that I'm having certain behaviors that I need to be working on?
Yeah. And I think that's more of what I'm at. Like there are behaviors that I am having that are not healthy behaviors. And I am trying every day to make it a little bit better, but I don't know. It's just, my brain is still,
well, yeah, I don't
it's mad I'm mad at myself.
Yeah.
That's what it is.
You just don't have all the tools. That's all.
Yeah.
And we can get you this.
Yeah. We now have a whole list of websites to go to.
Yeah.
So I can see a therapist, because your girl needs the therapy.
And that's
really
fine.
bad.
I think a lot of us do.
And I
Like-
love therapy. My mom has always been an advocate for, for therapy, and, that it helps. And sometimes you just need to go talk to somebody that isn't in your life and that is trained to give you advice.
Yeah.
And so I've never had a problem with it, except for right now.
I don't know.
Maybe you don't want someone to help you because you want to still be doing the behaviors that you're doing.
Oh, that's hard one to swallow.
Thank you, Dr. Shapiro.
That's a hard one for
I've
me.
told her I feel like she's punishing herself, and I don't know why she's punishing herself.
I don't know.
Like, we want you to get the help you need. So, yeah, and she's like refusing.
I'm not refusing. I say, yeah, okay, I'll get to it, and then I don't
Your
do
actions are refused.
You have to be ready.
it. Yes, and that's the other thing, is I have to be ready.
Yeah.
And I feel like I'm getting to that point where I'm going to be ready. I'm just not there yet.
Yeah.
Like I'm stepping
Okay.
closer every day, but it's not at that point where I'm like, oh no, I need to talk to somebody, like stat. Even though I know I need to talk to somebody stat, I don't want to realize that. I'm just
Okay.
gonna keep pretending everything's fine. I like to live in denial. Really, yeah.
I bet Dr. Shapiro did not know this conversation was going to go this way.
That's okay. I mean, often I don't know where the conversation is going to go.
So
That's
true.
the fun
That's-
part.
That's a good
It's true.
point.
Yeah.
Yeah. When I got diagnosed with my autoimmune diseases, I lived in denial for a year that they were even happening to me. Like, I was like, nope, I'm totally fine. I don't know what you're talking about. I just take these pills and then I'm good. Even though I couldn't move, I couldn't stand, like I was sick every single day. I was just like, nope, everything's fine. I'm good.
Yeah. Mhm.
And my other friend, she was like, I'm giving you a year. You have a year, and then I'm going to start kicking your butt, and you're going to have to start figuring this out.
Yeah.
Because this is the rest of your life. And
Yeah.
she was like, but if you want to live in denial, I'll give you a year. And she gave me the year, and then she kicked my butt, and I figured it out. But that's where I'm at right now. I like to live in denial. Everything's fine. It's fine.
Yeah.
I say that a lot.
Well, I like what your friend said. And that's kind of one of the things that I was saying before about setting limits. It sounds like she was really nurturing and she was there for you, which is what you need. And that's what you have to do for yourself, is be nurture yourself, but then set limits. I'm giving you a year. Mhm.
Yeah. I mean, I could say I'm giving myself a week, and then it needs to be done.
Oh.
Because it's been 6 months. It's been 6 months of me.
No. What I will say as your partner in this 100%, it hasn't been the 6 months. What has changed is these last 4 weeks. So we can get it fixed.
We can get it fixed. It's fine.
Just put your own limit, like she's talking about.
Yes.
Get yourself your own comfortable limit, because like I can't do that for you. That's all your comfortability, what you want.
I'm an adult.
Yes. Like,
Yes.
You can do this.
Yes.
So,
Mhm.
but
And maybe starting small, like if you're not ready to make an appointment, maybe looking at some of those websites and making a list of providers.
Oh, that's a good point.
yeah, like one thing at a time. So
Yeah.
you don't have to feel overwhelmed.
Yeah, it doesn't feel like there's too much.
Yeah.
Because I think that's like, there's a lot happening, and like these things keep like pressing down. And I feel like I'm like, there's too much. Like I can't dig my way out of all of it. I think that's a lot of
Yeah.
it. So I think if I take it one step at a time, look at providers.
Yeah.
Then like set it aside for a week and then go back to it, or
Yeah.
whatever.
Whatever you're
I mean,
comfortable with.
does that sound healthy, or is that-
Absolutely.
okay? I
Yeah.
was like,
Yeah.
maybe I'm not
Because
healthy.
you're doing something.
Okay.
Yeah. So I think that's good.
So if I ignore it for the next 6 months,
Okay. Well,
that's not healthy.
Not at all.
She's looking at me like, you are crazy, girl.
Well, no, I mean, like, let's play it out. If you ignore
Okay.
it for 6 months, what could maybe happen?
Gain more weight, lose my
Mhm.
mind.
There's a lot of professional stuff that we need to get done. So I don't know.
Yeah. She's like, you don't have time to have a breakdown. So could you just call a therapist, please?
Well, because I'm very big at being like preventative care. I'm
Mhm.
very about that.
Mhm.
And so it's funny because like we've been best friends for 20 years. And so it's just like, I've always been like, I want to prevent the problem. So when I can see it, so I'll tell her my concerns, and I've told her my concerns. And so I'm like, hey, here's how to fix them. You figure out your timeline on fixing it, but you can't just ignore it. And that's how I've always been. It's like, I don't like to feel pain. I don't like to feel sadness. I don't like to be sick. I don't fucking like to cry. So if I can prevent all of these things, I think I actually work harder to prevent them than actually just doing them sometimes.
Mhm.
But it's just, I don't want people to be sad. Like, that's why like I like to entertain and tell jokes and have fun, because I'm like,
Mhm.
life is too fucking short to be stressed out all the time.
Mhm.
Like, we need to enjoy us being here. Like,
Mhm.
why am I stressed out about a mortgage payment right now? Like, who cares? Like, just live, just get in
Mhm.
your yard, get to a park. I don't know, do something, just get out of the house.
And I
Yeah.
like to ignore that there's anything going on.
I like to like, I recognize it and nip it in the butt, because I'm like, nope, we don't have time for you. We do not need to stress.
Yep.
So,
But I am a queen of stressing. I stress
I'm
about
learning
everything.
that.
I stress about the light turning red up ahead of me. Like, literally, I stress about everything. If I'm in my car, I'm like, what was that noise? Is that my brakes? Oh, my car's going to break down. That's it. That's just happening. Like, that's where
You're
my
very
brain,
dramatic. Yeah,
like,
you're gonna be dramatic.
I am dramatic. But that's, I stress out over everything. And normally I can function, but when you add all the other stressors on top of it that are out of my, like, I can't say, okay, this is a completely oddball thing to stress about. Stop it. Like, I have like actual stressors.
So like, what I tell myself to get through those stressors is, I think to myself, why do I care? And then I think about it. And then I realize, why do I care that this light's red right now? Like, I have plenty of time to get to where I'm going. Why am I mad? And so I just don't be mad, because I'm like, there is no reason. If there's legit no reason for me to like be upset, then I'm like, then I just stop. So that's
I can't turn it off
my
like that.
brain can do that. I don't know why, but it can. So I'm
That's
just like,
interesting.
but I do think to myself a lot. Like, I'm in my head a lot. And so like, I have like I've built this relationship with myself where I'm like, we have to check in all the time, because like no one ever, and you know this, Tessa, this, no one fucking ever asked me how I'm doing. So
I
guess
do.
what?
I do.
I know, but I've had to like tell people, like, there's a reason why I don't let people in, because if you're not going to ask me, then I'm not going to tell you stuff. So I'm always up in here. So I have to check in with myself to make sure I'm cool.
I check in the mornings.
I learned at a very young age, like, you live with yourself, so we got to be okay.
Yeah.
So
I think a lot of what you're doing is applying the cognitive behavioral therapy skills. You're saying, why do I care? What's the worst thing that can happen? And then you answer the question, and then it leads to you being able to manage it.
I like that. I didn't even know I was doing it.
Mm-hmm.
Okay.
So you're doing the right things.
Cool.
All right.
I like it.
So we all need to be more like Melanie.
Well, and if you have a hard time doing that, that's where the pause button comes in, right? Like, literally envision yourself pressing a pause button and saying, what's the worst thing that can happen? Why is it a big deal that I'm at the red light? And see what comes up.
Yeah.
Because there's nothing. I mean, a red light's going to turn red light or red, whether you are going to stress about it or not. So what's the point of stressing about that?
Well, and that's its function. So
yeah, that is its function, is to turn red.
But like, that's how I have to break it down. You got to break it down to like the simplest forms, and then be like, oh, why am I mad? This is goofy. So, but back to
body dysmorphia.
Okay.
So with body dysmorphia, so basically, just because I can't sometimes see, like, I still see the older Melanie, that doesn't mean that I actually have like body dysmorphia. I just have like a body image situation.
Yep.
Okay. So there's levels in between.
Yeah, I mean, the way I look at it is like, this is specifically related to your weight and your surgery.
Okay.
Right. So it's not like it's this perceived thing that you just hate about your body.
Okay. So what does a typical or common theme with body dysmorphia that people have that you see?
Someone who has like thinks that their nose is really big when it really isn't.
Okay.
And they're focused so much on it.
Okay.
Right.
All
Or
right.
someone that may think their hands are too big.
Okay. What? You're ridiculous.
She said that my hands look like man hands in high school, and it's never left me.
Yeah.
So
I
when you said
realize
big hands, I'm like,
I fucked you up.
Mm.
I'm sorry.
man hands in your face.
This is
Yes.
the part of being a teenager that you don't know your words actually have impacts. Okay?
Yeah.
Yeah.
I didn't know.
I
didn't
forgive
know.
you. It's just she said hands, so I had to.
I know. I
I
got
had
the
to put
look. I
that
was
in
like,
there.
I know. Man hand.
Yeah.
You
These
don't-
comments stick with us.
Yeah.
They do.
You have lovely.
Yeah.
Thank you.
You're welcome.
Thank you. I appreciate that. Now that's gonna stay with me instead of the man hand.
Yay.
Yes.
Okay.
But I think we have to really look at like the whole perception thing.
Mhm.
You know, I mean, if someone had any kind of a surgery and has a scar and they're really concerned about how it looks, that's not body dysmorphia. I mean, the scar is there. It's not this perceived imaginable thing. It's there. It's a
Okay.
body image thing. Can we accept it?
Okay.
And I think people, and I know I did, are getting confused between the two for
Mhm.
sure.
Yeah.
Because if people are asking, like, how do you prevent body dysmorphia? Is that even a thing that you can do? Or is that just literally your brain just sees something different?
Well, I don't know if you can prevent something that
Mhm.
happens in your head, because thoughts are thoughts. We can't really stop our thoughts,
Mhm.
Okay.
right?
Okay.
But you can work with it.
Mm.
So if someone's having these thoughts about themselves, they can use the cognitive behavioral therapy skills to look at those thoughts and examine them, you know, or maybe think about fact versus judgment,
Okay.
right? I mean,
Can we go more
fact,
into that? Yeah.
Yeah.
yeah, like a fact might be I lost 100 pounds and I have hanging skin. Judgment might be everyone thinks I'm disgusting.
Ah, there we go.
Yeah.
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 That's a good one.
Mhm.
You just silenced both of us, and that does not happen very often.
Nice.
We're just like, oh yeah, that makes more
I
sense.
visualized it. I was like,
Yeah.
okay,
Yeah.
okay.
Yeah.
Yep.
That makes more sense.
Yeah.
Because I know I have stretch marks on the back of my arms.
Mhm.
Always bugged me. I don't like them. I would wear long sleeve shirts in the summer just so that people didn't see them. And that is more of a, I don't know if that, which, like, because it's a fact, I do have stretch marks, but I
Mhm.
also think they're disgusting.
That's the judgment.
Yeah.
Okay.
Yeah. You're
Okay.
judging yourself.
Yeah.
Yeah.
Oh, yeah.
Gotcha.
Yep.
Okay.
I just want to make sure that like
Yep.
made sense.
So it sounds like when we talk about having body dysmorphia, we have body image issues.
That's the way I look at it.
Okay.
Okay. So we need to kind of change that verbiage in the community, because
To body
you
image.
saw all the questions we got, and a lot of it was about body dysmorphia, but I
Uh-huh.
think it's because it's confused.
Mhm.
Yeah, and I think it's kind of what's out there in the media, or
Mhm.
what people are reading online, or I mean, it's out there. And the bottom line is it's terminology. I mean, it's really not a big deal if that's what people want to call it. They can call it
Mhm.
whatever they want. But the issue is what are we going to do about it?
Yeah, because I'm thinking if you're calling it the wrong thing and you're looking for somebody to help you treat body dysmorphia versus a body image issue, those are two different
Yeah.
things.
Yeah. Yeah.
So you're not going to get the correct treatment if you're calling it body dysmorphia, but really you have a body image issue.
Right. Right.
Okay.
So for example, body dysmorphia might do a lot of, like, if we take the hand example that we were working with before, you know,
Yeah.
maybe using, you know, facts about that, you know, like if you measure your hand, what is the average size hand? Okay. Is your hand within that realm? Okay. You know, so yes, you had one friend that made a comment. Have other people made comments? Have anybody said anything? You know, we would kind of like, yeah, we would want to work on like the facts that support this and maybe get the person to hopefully change their view. But if their view can't be changed, then we have to do acceptance, right? Okay, so you have big hands. What are we going to do about it? Right? We can't change it. So
No.
these are your hands, you know, and the same thing with some of the other issues that people might be dealing with after surgery. If it's something that you can't change, it's okay. Well, now we have to accept it.
Okay.
Oh, I like that.
So if you have hanging skin
Mm-hmm.
and you can't have surgery right away,
Mm-hmm.
then that's forcing you to accept what is on your body. Like,
Right.
okay.
Right. Because I think it would be very invalidating to have someone challenge whether or not they have hanging skin. If they lost 100 pounds and they're saying that they have hanging skin, they may be actually seeing their body correctly, not distortedly. And now we have to accept it.
Got it.
But what it doesn't mean is the disgusting part.
Yeah.
That we were talking about, the judgment
Of yourself.
Right.
Because most people are going to look at you, and I've said this on here before, like I see flaws in myself, but Mel sees me as a friend. She doesn't see those flaws, and vice versa. I look at Melanie and I see a beautiful person, but she's like, oh, I don't like my stomach in that or whatever.
Right.
But I don't see that. I see the beautiful person.
Right.
So that's where like the perception is off.
Yeah, the body image.
Yeah. And you can ask yourself, like, what would I say to a friend if they were saying this?
I would not be friends with them if they were telling me what I tell myself. I would not.
Well, right. But and the other way around, if your friend was saying what you're saying to yourself about herself, what would
I would
you
say? You're beautiful.
Yeah.
Yeah.
It doesn't matter. Like, yeah.
Well, and I think we're all just worried about like more than just our friends' like opinion or like of what they think, because like we know, like I know what you think of me, but when someone sees me from like across the street and I'm wearing something that I don't really feel is flattering, then I feel like they're, just because I think it's flattering, I'm assuming that they think it's unflattering as well and that they're going to judge me. But really, I don't even know where that comes from. It's just coming from myself, I guess, because I'm just like projecting my feelings onto them, even though like they might even see it. They might even know I have an apron. It just might be me being like, I know that I have one, so obviously you can see it, but not really.
But most people don't even take the time to look at that. Like if somebody's across the street for me, I'm not going to be like, what does their stomach look like? Like I want to make sure that I completely analyze this random person that's across the street.
Exactly.
I mean, yeah.
And because you have your own body image stuff going on, you're kind of have this antenna up for picking up in the world what other people see. And so someone might be looking at your shirt because maybe they like your shirt, or they're wanting to see those two people that are on your shirt. And who are they? Or, oh, are you one of them? Or what is it that you're wearing? But in your head, you're like, they're looking at my stomach.
Yeah. Yeah.
Okay. So it's a perception.
It's a perception.
So question, if you have, so say you're having body image issues because of loose skin or you, and so you start looking into plastic surgery. Is that going to be, is it better to deal with your body issues before you have plastic surgery? Or is it like what time frame would you suggest doing plastic surgery, like to be in a good mindset to accept like,
yeah,
I don't know.
Well, I think probably at least 2 years,
Okay.
To wait.
Okay.
I think that it could certainly help a lot of people as well. I mean, if they did surgery and they did everything that they were supposed to do, and they do exercise and they do follow all the rules, and they still have the hanging skin and it bothers them so much. And they have the means to get the plastic surgery. I don't think there's anything wrong with that.
Okay. I wasn't sure if there was like a mental space that you need to like, that would be better for you to be in order like to be the healthiest mentally going into that. Cause I know sometimes it can mess with you too.
Sure.
Cause then you want more plastic surgery. Cause then you don't like, then you start picking out all of the other flaws that you could have fixed.
Right. Well, true. Right. So you do have to certainly be careful about that. It's not going to turn into this domino thing.
Yeah.
Yeah. And I think that if one can accept while changing,
Mhm.
that could be really helpful. You can go through skin removal surgery and at the same time accept where you are.
Okay.
That makes sense.
You
you-
are good, lady. You're good. I'm like,
Thank
this
you.
is like mind blowing. Yeah.
I love it. Do we have
Well,
any
thank
more
you.
questions from the followers? I feel like I
So
want to
I
make sure we
feel
hit them
like
all.
we hit pretty much the only one. Does food addiction ever really go away? This was a very specific
Oh
question.
boy.
And I was like, I feel like I really need to know if does it really go away or does it just stay dormant? Like,
I feel like,
This is a huge question
oh,
because the term food addiction is so controversial anyway. Mhm.
oh, okay. What's the
Yeah.
definition and why is it controversial?
yeah.
Well, I mean, can we really be addicted to food? We need food to live.
Right.
Mhm.
We need food.
Mhm.
So when we're addicted to something, what does that really mean? Is it a substance in the food that we're addicted to?
So
Yeah.
like the sugar, like you're addicted to the sugar, you're not addicted to the actual like
Food
eating
itself.
Maybe,
Okay.
Okay.
right? And we don't have too many studies that have really looked at sugar. I mean, we have some from rats and, there are some initial studies, but
Mhm.
I mean, is it really this addiction where there's withdrawal and tolerance? And maybe there is, because if we look at the definition of addiction, and there are 11 criteria, we can certainly match a lot of that to binge eating or quote food addiction, whatever that
Yeah.
is.
Okay.
So, but again, in terms of terminology, like regardless of whether or not food addiction exists, the bigger issue is that people feel addicted. People
Okay.
feel that it's very, very difficult, if not impossible, to stop. And will that ever go away? And, I think that there's no real answer to that. I think for some people, it certainly does go away. And if we kind of can say it's in some ways similar to binge eating, some people after surgery are no longer binge eaters. And it is really helpful, but some people still have the issues afterwards.
Yeah. I mean, I did good for like a year and a half. I was like doing really good. And then it was just like, then it just like took a turn.
Mhm.
And it took a turn into binge eating disorder land. Don't like being there. So there is a difference between binge eating and food addiction, because binge eating is an actual like diagnosis, right?
Exactly.
And food addiction, there's not enough information on it.
Exactly.
Yeah.
Okay.
Yeah,
Okay.
one's a
Right.
disorder and one's like a definition.
Okay. I wanted to make sure that everybody knows that.
Yeah, because like I felt like afterwards, I felt like I realized that I had some sort of because it was interesting because after you were talking, like maybe it was binge eating, but I still feel like it's more like a food addiction situation, to where like the need of wanting food was just always prevalent. And then like after having surgery, like I felt like I had like a detox with having like all the protein shakes in the water. And then once I like reset everything, then I didn't have all these cravings for all these other things. Like it wasn't until I introduced something again would I now recrave that item. And because I would treat it like I talk about all the time with a baby tummy, because we have to do liquids first, then we went into soft foods, and then we went into
Purees.
what? Oh, purees. Yeah. No, purees, soft foods,
Yeah,
and then regular
that thing.
food. And I actually did legit every single stage. And so that's why I get annoyed with myself for introducing that candy bar a year and a half later, because I didn't crave it until like someone's like, hey, do you want one? And I was like, yeah, I do. And then I took a bite, and then now I want one like at least once or twice a week. And it's just like, if I never introduced it, I wouldn't have had that craving. So I don't know if is it sugar? Is it like a dependence, or like, is it really an addiction or not? I don't know.
Yeah. And I don't think anybody really knows the answer to that right now, but we do know that certain foods change the reward kind of systems in our
Right. The
brain.
dopamine. Yeah.
Right.
Okay.
So certain foods may lead to that, which is very similar to what happens with alcohol or drugs. It's that reward center kind of gets changed in the brain.
Okay. I can see why people would consider it food addiction because it's triggering
That happy
the
sensor.
same kind of like satisfaction.
Satisfaction.
There we
That
go. There we
I was like,
go.
I know it. It's like right there. I just can't say it right now.
Yeah, no. Okay.
Okay. Yeah. This episode, man. I'm gonna
These
go
are,
home and
these are big topics. So food
They
addiction,
are,
I
yeah.
mean, I don't mean to minimize it, but there is a lot there. in
yeah,
terms
I
of-
mean,
yeah.
if you're down, we may need to have another episode just to clarify food addiction because I think a lot of people get that confused with binge eating. It kind of goes back and forth.
Mm-hmm.
And I think some people think that they have food addiction, but they have binge or vice versa.
Yeah.
So,
Yeah.
and because we see it a lot in
this
the community. Yeah.
Yeah.
I hear binge eating a lot. I hear food addiction a lot. And that was one of the reasons why I wanted to make sure that we asked that because I know I wasn't sure if there was a difference or if it was just two different names for the same thing. So I'm glad that we know it's
we
different.
have a clear definition of binge eating.
Yes.
Food addiction, I mean, it doesn't necessarily mean it's binge eating.
Mm-hmm.
Because again,
Okay.
if someone had one donut an hour for the day, one donut every hour over the course of the day,
Mm-hmm.
that wouldn't be binge eating, but they may feel like they're addicted to it.
Okay.
Yeah.
Mhm.
So it's all just kind of on the individual and on the instance that these things are happening. So
Yeah, I mean, I think it's really hard to define that. I mean, we can
Mhm.
look at someone who uses cocaine,
Mhm.
and when they use it, they need to use more and more and more of it and develop a tolerance, or if they don't use it, develop a withdrawal, but they don't use
Mhm.
it every single day.
Right.
Mm.
But there
Mhm.
may still be some sort of a substance use disorder,
Okay.
right? And then we have smokers who could be chain smokers, or we have
Mhm.
smokers who could be, a few cigarettes a day, but it still feels like an addiction to them.
Mhm.
It's a very hard thing to define because with food, what is the addiction and what
Mhm.
happens in your brain with it?
Mm.
And is it an addiction to the specific food, or is it addiction to the feeling that food gives you because of the emotion that it's helping? There's
Mhm.
just so many questions.
Okay.
Well, and
Yeah,
I'm on the
that's-
wavelength where I just feel like almost any substance can be addicting.
Mhm.
Because I think no matter what we call it, like I know that actually like real drug, like cocaine and like meth and stuff actually have like a chemical that like makes it to where like you're addicted. But
Mhm.
I feel like as long as there's an emotion with it, then there can be an addiction there because like we're satisfying that emotion and that happy, like the feeling of being happy.
Yeah.
Yeah,
I mean, because some people are addicted to working out
feels good.
because it's that same type of feeling, right?
I'm
Yeah.
kind of glad that you brought that up. I thought this, but I don't know if I'm correct. Working out, that can help with just like eating disorders, yes, or just even just mental health in general.
Yes,
Okay.
absolutely. Yeah.
Okay.
Anything within a healthy range is healthy. It's when it becomes in excess, it's a problem.
Okay.
Okay.
Exercise, food.
Okay.
Got it. So it's all just
How-
moderation. As if you
It's-
can do it in moderation, then it's fine.
And feel your feelings.
Acknowledge, yeah, accept.
Acknowledge, accept the feelings that you're feeling, and do a grid system, do a calm system, write in a journal, do any of those options.
Yeah.
Yeah.
Well, before we let you go, is there anything you think that we may have missed or anything that you want to add to say to the community?
I think you guys are doing a fantastic job. I'm sure you guys are helping so many people out there.
Thank
So
you.
many people. Often people just don't have anywhere to turn. And this is, I'm sure, just so incredible, whether it's, having special guests or just hearing your own stories of your own struggles and for being so open and vulnerable and authentic, as we said before. So, and I really want to thank you for having me.
Thank you. Like,
Yeah.
it's right back at you
Yeah.
because like just over the course of the last hour, I'm like, I can see why you practice because you are very good at like pinpointing it, not in a judgmental way, but just like the information is there.
Yeah.
And you can make the choice whether you want to use that information or not, but that's your choice. And I like that you're not pushy. You're just like, here's the information.
Yeah.
Take it or leave it.
Yeah.
Yeah.
That's my kind of girl.
Yeah.
Well,
So
thank you.
thank you for being on. Like, I know this episode is going to help an immense amount of people.
I hope so.
Yeah.
I know it's helped us already. So.
Yeah. Yeah.
Yeah,
don't
my
see how I
pleasure.
couldn't.
Thank you. Okay.
Well, thank you so much for coming on.
Yes.
We appreciate you, and we will definitely maybe do a part 2 with you. So
We'll find some more questions.
yeah, yeah.
We'll get the hard ones. All right. And to all of our OSLP family out there, thank you so much for listening. Thank you so much for supporting us. And
Yeah, and if you guys want to see this video, you need to go over to patreon.com/OSLP, and you get to pick the tier. It's $10 or more. They do get all videos, and then you get to chat with us once a month.
yes, on our monthly Patreon meeting.
That's right.
Which is so fun. We love it.
It's a blast. It's a
Yes.
blast. We talk about all these things
Yes.
together. So
Yep. And so I guess we will see you guys
next
next time. Bye.